Now we're getting into many of the conditions that can affect the reproductive systems. I will warn you that this particular video does have graphic images of genitals that have been affected by various STIs. Now that the disclaimer is out of the way, let's talk about the different STIs and STDs that people can catch. There are two different types, viral and bacterial, that we will focus on. Viral diseases cannot be treated with antibiotics since antibiotics do not work on viruses. However, there are some antivirals. Some of the viral diseases are things like HIV, genital warts, also known as HPV, genital herpes, and hepatitis. These are all transmitted via sexual intercourse as well as other methods. It's important to note that some of these do not go away. Something like herpes and HIV you are stuck with for the remainder of your life. HIV is extremely important for that, as without proper treatment, someone with HIV can get very, very sick and would eventually die. Genital herpes, on the other hand, is something that will never necessarily kill a person. It would just make them uncomfortable. Bacterial diseases can be treated with antibiotics. So these are things that are little pathogens, little bacteria that are living on and in the genital tract. And these include things like chlamydia, gonorrhea, and syphilis. We'll talk briefly about HIV and AIDS since we've already covered this in a previous chapter. But HIV causes AIDS, or acquired immunodeficiency syndrome, which is the last stage of an HIV infection and leads to a person dying since their helper T cell count is so low that their immune system is compromised. This means that many other pathogens can cause infection to the point that it could seriously harm or kill the person, even though a healthy person would be completely fine and recover. It's important to note that HIV has no cure. Once HIV is contracted, it is there. However, treatment has been extremely successful in recent years. Treatment is called highly active antiretroviral therapy, or HAART for short, and this can limit HIV replication significantly, preventing a person from ever experiencing the harsh symptoms and realities of an HIV diagnosis. It's important to note, though, that this therapy must be used continuously, as failure to continue to use it means that the viral load will increase and symptoms will begin to appear. Genital warts are caused by human papillomaviruses, or HPVs. This can be transmitted skin to skin and without symptoms. So this one is something that's very easy to pass around. When someone does have symptoms, typically they have warts and lesions on the penis or the opening to the vagina. While this may not seem too terrible, it is associated with cervical cancer. Up to 90%, sometimes higher, 90% of cases of cervical cancer are related to someone's infection with a human papillomavirus. Now, you may be thinking, if I don't have a cervix, then I don't need to worry. You're wrong. In addition to cervical cancers, it's also related to many anal cancers and oropharyngeal cancers. So it's important for everyone to make sure that they are not catching something like HPV. The most common way people find out they have HPV is through the pap smear, and this is done in women. There is a vaccine, though, for the most common or the most detrimental forms of HPV, and this vaccine is available to pretty much everyone who is a young, healthy person, both male and female, and this helps prevent many cervical cancer cases as well as cancer cases involving the anus and oropharyngeal areas. It's important both for males and females to get this vaccine to prevent the spread of HPVs. Many places have been implementing large vaccine campaigns, like Australia, that have been extremely successful. The countries that have implemented these campaigns expect to see massive drops in cervical cancer cases because of the vaccinations. Herpes is another viral STD caused by herpes simplex virus, or HSV. And there are two main types we'll talk about. Type 1, which is typically found above the waist, and type 2, which is typically found below the waist. These are transmitted from skin to skin as well as secretions and can be passed from mom to baby. They cause ulcers, but they can also be transmitted when a person has no symptoms. And there are many things that can trigger an outbreak, such as a fever, stress, or sunlight. Type 2 herpes is usually what we think of when we think of genital herpes, whereas type 1 is usually the version we think of when we think of a cold sore. There is also no cure for herpes. Like HIV, once contracted, you're stuck with it. However, herpes does not nearly have the death sentence that HIV does without treatment. This is what herpes ulcers look like. We see both on the head of the penis as well as around the genital tract and genital openings on the female. Hepatitis is another STD that is viral. This causes infection of the liver by one of 6 different viruses: hepatitis A, B, C, D, E, and G. Hepatitis B is the one that is most commonly transmitted through sex. It can be transmitted through sex as well as contaminated blood, and hepatitis B can lead to liver failure. However, there is a vaccine available. Moving on to bacterial STDs, we have chlamydia. Chlamydia is extremely common. This is something that many people end up experiencing at some point in their life. And one of the positive notes is that this is something that can and is regularly cured. It's important to say why it's so necessary to get treatment, though, if you have chlamydia. Chlamydia is relatively easy to treat through a course of antibiotics. However, if it's left untreated, it can cause pelvic inflammatory disease. Pelvic inflammatory disease can cause sterility. Chlamydia can also be transmitted to a baby during birth, and that can cause problems with the eyes or cause pneumonia. So if a pregnant woman thinks or suspects that she has chlamydia, it's extremely important that she talk to her doctor to find out the best course of action to prevent these problematic things from birth. Chlamydia also does have an issue with not having symptoms. Many people, both males and females, don't experience symptoms, but if they do, typically it has a burning sensation during urination and a mucus-like discharge. For females, they typically experience vaginal discharge and symptoms that feel like a urinary tract infection. Gonorrhea is another super common bacterial infection in men and women, and again is also treated with antibiotics. Males will experience pain during urination as well as green, yellow-like discharge, whereas females, it's more uncommon for them to have discharge. While it is really common and easy to treat, leaving it untreated can have devastating effects. Gonorrhea can also lead to pelvic inflammatory disease and cause sterility in both men and women. It can also be contracted by a baby during birth and cause problems for the eyes, including blindness. Something to note that while gonorrhea is treated by antibiotics, there are some strains that are becoming resistant, meaning gonorrhea is becoming more difficult to treat going into the future. So the best way to avoid that is to not catch gonorrhea in the first place. Syphilis is our last bacterial STD. And this one's a little bit different. It's a little strange compared to the other two. And that has 3 stages that can span many, many, many years of someone's life. Stage 1 is the first 2 months after infection, where a hard chancre at the site of infection forms. Stage 2 happens 3 to 4 months after infection, and this is where a rash is found, sometimes even on the hands and feet. Sometimes hair loss or gray patches on mucous membranes are also experienced. And stage 3, which is 5 to 20 years after infection and continues until the person dies, is where there are problems with the cardiovascular system, the nervous systems. Ulcers can develop on the skin as well as on the organs. The thing that makes syphilis really strange with this is that in between the stages of stage 1 and 2 and between stages 2 and 3, there are seemingly empty periods, meaning a person doesn't necessarily have symptoms. That's really, really strange, and it can make it really hard to diagnose because of these latent periods that you find between the stages. Syphilis can also cross the placenta and affect a developing fetus. So again, for those who are pregnant, it's extremely important to talk to your doctor if you think you may have contracted something like syphilis. Some other common infections of the reproductive tract include bacterial vaginosis and trichomoniasis. Trichomoniasis is caused by a protozoan called Trichomonas vaginalis that can be passed around similar to an STD. This is a common cause of vaginitis and causes frothy discharge, a foul smell, and an itching sensation. Bacterial vaginosis, or BV, accounts for more than half of the cases of vaginitis in American women. BV is not necessarily transmitted through sex. BV is just where the normal bacteria found in the vagina have been disrupted, and so that certain species of bacteria are overgrowing when they normally would be kept in check. So something like the bacteria Gardnerella may overgrow and overstay its welcome to cause BV. It's not uncommon for someone to experience something like BV or even a yeast infection after taking antibiotics for a different condition, because taking those antibiotics will disrupt the normal flora of the vagina as well as treat the problem that the person originally had. Candidiasis is an overgrowth of normal yeast, Candida albicans, that's found in the vagina. It's completely normal for this yeast to be found in the vagina. A yeast infection, which is the common name for candidiasis, is just the overgrowth of this yeast. The tissue becomes red, inflamed, and itchy, and sometimes has a white, thick, curd-like discharge. Sometimes taking birth control hormones or antibiotics can lead to an increase in the risk of developing this. Like I'd mentioned with BV, taking antibiotics disrupts the normal flora of the entire body, including the vagina. And so while you may be taking antibiotics for something that you have going on with your respiratory system or your skin, you may end up experiencing something like a yeast infection or BV after taking your antibiotics because the normal flora was disrupted. Luckily enough, these are relatively easy to treat, and for many cases can be treated over the counter through something like Monistat. So how do we prevent ourselves from getting these STDs? We had mentioned abstinence as a primary form or a most efficient form of preventing ourselves from getting pregnant. It's also the most efficient form of preventing ourselves from getting STDs. However, like we mentioned, it's not a realistic lifelong method. Most of us at some point are going to engage in sexual intercourse with another individual. So what are some other things we can do to prevent ourselves from getting an STD? We can have long-term monogamous relationships. If you've been with your partner for a very long time and you know that your partner is only having sexual intercourse with you, then those particular infections can't necessarily get in. However, if your partner uses drugs, like IV drugs, you do need to be aware that you're at a higher risk of getting certain STDs, like HIV or hepatitis, because those both carry a risk of developing them by sharing needles as well. Another way to prevent the transmission of STDs is to avoid anal rectal intercourse. Anal rectal intercourse has a tendency to have more damage occur to the anal tissue compared to the vaginal tissue, as vaginal tissue is designed for sexual intercourse, and the tissue found in the rectum is much more susceptible to damage. And in general, practice safer sex. Use a condom, avoid oral sex, and make sure that you're not abusing alcohol or drugs that may impair your judgment or change your behavior. If you're normally very, very cautious and you use condoms every time you have sexual intercourse, except when you drink, That's something to think about.